What if you stopped brushing your teeth for a month? The shocking truth. Explained. Let me just ask you something. What if you stopped brushing your teeth for a whole month? No toothpaste, no toothbrush, no floss, no minty rescue from mouth madness. Just you and your unbothered bacteria. It sounds like a weird science experiment. But guess what? It's also a legit nightmare scenario according to dentists. Today, on Wise Trump 07 Ed, we're diving, mouth first, into what actually happens inside your mouth if you ditch your toothbrush for 30 days. Spoiler, it's not pretty, but it is fascinating. 1. Day 1 to 3. The slippery slope begins all right. Day 1. You skip brushing. No big deal, right? We've all done it. Maybe you overslept. Maybe you were camping. Maybe you just forgot. Your mouth feels a little grimy. Maybe your breath's a bit funky. But life goes on. By day 2 or 3, things start to shift. Your mouth feels sticky. That fuzzy sweater feeling on your teeth? That's plaque, a film of bacteria and leftover food doing a conga line on your enamel. The American Dental Association says plaque starts building up within 24 to 48 hours, and if it's not removed, it hardens into tartar. Fun fact, you can't brush tartar off. That's dentist-grade stuff now. You've officially started building rock formations in your mouth. 2. Week 1. Bad breath and bacteria parties. By the end of week 1, your mouth has gone from forgot to brush to full-on biohazard zone. You've now got billions of bacteria partying between your teeth and gums, and they are not polite guests. One of their biggest gifts? Halitosis, aka bad breath that could peel paint off a wall. According to the Mayo Clinic, poor oral hygiene is one of the main causes of persistent bad breath, thanks to bacteria breaking down food particles and releasing stinky sulfur compounds. So yeah, your breath now smells like a mix of onions, despair, and broken dreams. 3. Week 2. Bleeding gums and early gingivitis. By week 2, things are getting spicy, in a bad way. Your gums may start to look red, puffy, and inflamed. You might even notice bleeding when you eat or just poke at them. That's not from brushing too hard. That's gingivitis, a mild form of gum disease. The National Institute of Dental and Craniofacial Research, NIDCR, says gingivitis is caused by, guess what? Plaque buildup irritating the gums. And the worst part? Gingivitis is silent. It doesn't always hurt. So you might think you're fine, while your gums are silently plotting revenge. 4. Week 3. Gum damage and enamel erosion. Welcome to week 3. At this point, your dental health is on a steep decline. Tartar has cemented itself to your teeth like a barnacle. Your gums are inflamed and starting to recede, exposing parts of your tooth roots. Sensitivity? Through the roof. Also, without brushing, your enamel, the protective armor on your teeth, is now under constant attack from acid-producing bacteria. And when enamel breaks down, it doesn't grow back. Let that sink in like a dentist's drill. 5. Week 4. Cavities, pain, and gum disease. Day 30. You made it. And by made it, I mean you now qualify for a VIP tour of your dentist's worst-case scenario folder. Your breath? Weapon grade. Your teeth? At risk of cavities, which the ADA says form when acids from bacteria eat through your enamel. Gums? Likely bleeding, receding, and on the road to periodontitis, a serious gum infection that damages soft tissue and even destroys the bone that supports your teeth. Yes, bone. By now you may even feel pain when eating, talking, or existing. 6. The comeback plan. What you should do. Here's the good news. If you haven't hit the bone loss stage, you can still recover. Gingivitis? Reversible with consistent brushing, flossing, and professional cleanings. Cavities and tartar? Gonna need a dentist, maybe a filling or two. But it's fixable. So here's what you should do. Brush twice a day with fluoride toothpaste, floss once a day. Yes, it matters. Drink water, especially after meals. Visit your dentist every 6 months, and please, don't wait 30 days to start. So what happens if you stop brushing your teeth for a month? Your breath stinks, your gums bleed, your enamel erodes, and your dentist gets very rich. The moral: 2 minutes of brushing a day can save you thousands in dental bills and keep your smile from turning into a dental horror story. Drop a comment. What's the longest you've gone without brushing your teeth? Be honest. We're judging softly. Don't forget to like, share, and subscribe to Wise Trump '07 Ed, where science meets real life, with a splash of humor and a hint of minty truth.